Ever wondered why some injuries from car crashes can lead to never-ending pain? Well, today we're going to dive into the hidden causes of chronic pain behind car crashes. Why is this video important to you if you were injured in a car crash? Because improperly diagnosed car crash injuries not only can result in chronic, debilitating pain, but it can also be financially costly due to a poor settlement. More about that later in the video. Also, don't miss out on a special bonus at the end of the video where I will guide you to a resource to help you find a local provider who can help you to examine, diagnose, and confirm your injuries with solid, objective proof. Hello, I am Dr. John Brockway. I am a chiropractor in Denver, Colorado. I've been in practice for over 13 years, and I've helped many patients with their chronic pain conditions. One of my specialties is in the diagnosis, management, and treatment of injuries caused by car collisions. Before I dive in, I need you to hit that subscribe button if you want to get more tips on how to relieve acute and chronic pain like this so that you can do more of what you love. One of the biggest causes behind chronic pain from car crashes is hidden injuries that were never properly diagnosed, documented, or treated. And that's why hidden injuries are best to be assessed and diagnosed by a spine specialist, such as a chiropractor. Even better, a spine specialist with specific training in the diagnosis and management of car crash injuries. So let's talk about how we properly diagnose and document these hidden injuries, and then we'll talk about how these injuries are treated. So one of those tools that we use in our office to help to assess for hidden injuries is called the MyoVision Dynarom. Now, this is a fantastic tool for discovering those hidden injuries. Now, something you need to know about this is that it is considered non-invasive, so it only gathers information from your body. So there's nothing scary about it. The scariest thing are these little stickies that are going to go onto your neck or onto your back, depending on wherever the injury is. And what this does is it helps to gauge not only the range of motion for your spine, but it'll also tell us the quality of the range of motion for those muscles. Let me give you an example. I'm going to show you here. This is a real life example of a patient. So this is an ideal situation here on the left. Let's have a look at this one. And this particular range of motion is bending forward. So what we should see are the blue and the red lines engaging together as we start to bend forward. So we can see that here, they're slowing down. As we get to the end range of motion, what we start to see are the blue and the red lines not engaging at all. Now, the reason for that is at that end range of motion, it's not actually the muscles that are working anymore, it's the ligaments that are holding things together. So we should not see the muscles firing at this end range of motion. As we start to come back up, that's this movement pattern here, those muscles start to engage again, we start to see them peak, and then they relax once we're standing in an upright position. Now, down here at the bottom, we also have the range of motion. This blue line represents the ideal range of motion according to the American Medical Association. In this particular case, it's 50 degrees. So we can see the red line is above that, which indicates that that range of motion is above the acceptable range of motion that we should have. Now, let's look at our patient. The first thing I want to show you is the range of motion. So let's have a look down here. Look at the red. The red is above the blue line, which is good, right? Well, that's where most exams will stop and they'll simply say range of motion is normal. Let's look at the second half of the equation though. Check this out. Quality of the movement. We're looking at this, the red and the blue aren't firing together or they're not moving together. And at this end range of motion where it should be totally flat, we actually see a difference here. What this lets us know is that that end range of motion when those ligaments should be holding things together, we see an issue here. And that lets us know, there's something else going on. It also lets us know this patient is also likely in pain. If you've ever wished someone could see the pain that you actually feel, then the Dynarom is the exam that you want. So we had some additional information. We had an x-ray done. I'll show you what that looks like. That tells us a little bit more about what was going on with the patient. An x-ray was done. We were having a look at the disc spaces here, and we start to see that they are decreasing in height right down here at the very bottom. That information combined with the Dynarom data and the patient's subjective complaints in the form of lower back pain. They also had abdominal discomfort that was new, and they had traveling pain going down the backside of their legs. Gave us an indication that we should probably get some additional diagnostics done. So we had a lumbar MRI done at a local imaging facility. And here are the results there. And here's what we were able to discover. There are 2 disc bulges that are going on into the lumbar spine. So this helps us to not only document the extent of the injuries, It helps us to diagnose it as well, so we get that properly assessed, and then we can come up with a best treatment as a result of that information. So let's talk about some of those things that we're doing for these patients and this particular type of injury, as well as some additional treatment options that might work well for you. So with this particular injury, the discs or the cushioning material have been compressed, and that's what's resulting in not only the pain, but some of the traveling symptoms as well. I'll show you what that looks like. We have the disc here, it's the cushioning material in between the bones. So since it's been squished or compressed, what we want to do is we want to focus on treatments and therapies that help to open up that disc space. I'm going to show you a couple of those things that we use here. It could be something as simple as a tool that a lot of people have at home. This is a teeter, and this is a passive means of traction. It's going to help to open up that space, allow the disc to breathe, and allow some of the nutrients to get in there as well, decompress the nerve, and help some of those radicular complaints, including the traveling symptoms going on perhaps into the legs or the abdomen, whatever it may be. Now, I like this. It's passive, and this is good in some circumstances. Even better, this is something called an invert track, and this is something you can't necessarily get unless it's prescribed by a doctor, but I really like this because you can see right here there is not only a stretching component and a decompressing, it's very isolated to the back. We also have an extension movement here, and that's really good for strengthening the supporting musculature. So whenever we sustain an injury, especially a disc injury, usually means that some of the ligaments have been torn, the disc has been compromised in some capacity, and we want to focus on doing as much as we can with what we have. In this particular case, it's going to be strengthening the supporting musculature. So this is a great way of getting that passive stretch and combining it with active movement in order to engage those muscles and get them nice and strong so there's less issues. Now, traditional conservative treatment options for managing these hidden injuries include ice, heat, pain meds, rest and stretching, or physical medicine such as physical therapy, chiropractic, and massage. Now, if symptoms persist despite conservative care, we might need something slightly more invasive. For example, this could be a referral to a pain management specialist for a cortisone shot or a nerve ablation procedure, or my personal favorite, and that is regenerative orthopedics. This is something like platelet-rich plasma or prolotherapy that are offered here locally at the Centeno Schultz Clinic. Now, in some cases, surgery is the best option. This can be removing a portion of the disc. This can be removing the entire disc and replacing it with an artificial one, or fusing the spine. Now, to this day, I still have a patient that swings by the office to thank me for referring him to a local neurosurgeon and how that procedure changed his life for the better. In his particular case, he would stand and he would stand for just a few minutes, and then he would lose all the sensation in his legs. So he'd either fall down or he would have to have his spouse help him out with staying upright. After the procedure, had none of those symptoms anymore. So very grateful for that referral relationship that we have with some of our local neurosurgeons in order to make that happen. So by now you may be asking yourself, well, what is the single best question to ask a healthcare provider to see if they can help with my hidden injuries? And that is this: what's your plan to diagnose and document my potential hidden injuries? I'll say it again because it's really important. What's your plan to diagnose and document my potential hidden injuries? The truth is, the answers may vary, but there should be a clear and immediate answer that may include something to the effect of, well, we utilize the Dynarom from MyoVision, we refer for digital motion X-ray or MRI, or we have a referral team of medical providers for additional diagnostic and treatment options. So some of the exact treatment recommendations we make for patients who sustain these types of injuries include an initial assessment where we get a gauge of your subjective complaints as well as how it's impacting your day-to-day activities. And we normally have a course of care of about 2 to 4 weeks where care will consist of corrective chiropractic care, laser phototherapy, some form of traction decompression therapy is also common. We might recommend some custom foot orthotics. We also want to help to improve the spinal curves in your body. We can do this with several things, including the posture halo, dinner roll, or a spinal orthotic, or a posture pump, depending on your presentation and needs. Lastly, we also utilize a specialized treatment called the pain neutralization technique. I love this treatment because we look for areas of tenderness, And it's a very gentle treatment. The treatment is very effective and it's very quick. It has one of two immediate effects. It either turns down pain like a dimmer switch or turns it off like a light switch. We also have periodic re-exams. It's really important. We want to be able to check in with you, find out how you're doing, what's working well. If we're not making the improvements that we need, we can either consider changing up the types of treatments that we're doing for you, refer you for additional imaging, and or get you connected with a local medical provider for additional assessment and treatment options. So switching gears here a little bit, I want to give you an analogy so that you can better understand this. Have you ever started reading a book and someone tore out some of the pages and you missed that portion of the story? Maybe you've been to a movie and you had to leave. Something came up, your phone rang, a family emergency, someone pulled the fire alarm and you had to leave. Well, what am I getting at with this? This is an incomplete story. And your recovery from a car crash is very much telling a story. And this is very much a settlement consideration for the claims adjusters and everyone that is involved in this sort of situation. Let me give you a very real world example. We had a patient who came into our office and she came in as a result of a car crash. She was evaluated here, but she told us prior to coming in that the claims adjuster had already contacted her and offered her $750 as full and final payment for her injuries as a result of the car crash. Now, I can't really fault the claims adjuster for doing that. It's based on very limited information. I don't think they had any medical notes at that point. They didn't necessarily have an updated diagnosis from any of the treating doctors or the doctors making assessments. So, but to give you a little context, that $750 might cover a few x-rays and that's basically it. Not really a whole lot of treatment. So just something to consider is when you're having these injuries, you want them to be properly documented so that people can really appreciate the extent of the injuries, what it is that you're feeling, and the types of care that's going to be the most appropriate for you. Car crashes are one of those things where there is one thing that everyone can agree on, that being the claims adjuster for your own insurance, the at-fault party, all the attorneys that are involved. Everybody wants you to feel better. And the best way to do that is to get things properly documented and subsequently proper treatment. So when you're telling your car crash injury story, which portion do you want to leave out? And it's kind of a silly question, right? Of course, you don't want to leave anything out, but the point that I'm trying to make is if there is an option to seek out additional diagnostics in the form of the Dynarom, the MRI, or some of these additional things, you should probably consider doing those things. Now, thanks for sticking around with me to the end. Here is a bonus for you that you've been waiting for on how to find a local medical provider who can examine, diagnose, and confirm your injuries with solid, objective proof. Here's what I want you to do. Go to myovision.com. I'll spell that for you. MYO, V as in Victor, ISION.com. On that website, you'll see a link for resources. Click on that, and then you're going to click on Doctor Locator. Go ahead and put in your zip code, and what you want to do is you want to refine your search and look for a doc that has the Dynarom certification. Now, these are docs that have been certified, trained, and they can provide the Dynarom assessment to help to tell that story of your injuries and your recovery associated with the car crash injuries that you sustained. And if their website is being a little fussy, you can probably do a local Google search for Dynarom. That's D-Y-N-A-R-O, M as in Mike, plus your zip code or your city. And hopefully that will lead you in the right direction of a provider who can do that assessment for you. And now I want to hear from you. If you were injured in a car crash and are still suffering with chronic pain, share your story in the comments below. Tell us what's been working for you and what hasn't been working for you. Which advanced diagnostics have you had to better tell your story? I want to encourage each of you in your journey through the healing process to seek out those advanced diagnostics, find those hidden injuries, and get the care that you need in order to get back to life again. Neck pain is a common pain complaint following a car collision. If you are suffering from chronic neck pain, this is the next video that you should watch called The Top 10 Common Mistakes That Are Hurting Your Neck and How to Correct Them. Go watch it right now and learn how to relieve neck pain.